Hi guys, welcome back to MedMinds where we simplify all medical knowledge. So today we are going to be learning about pharmacology for beginners. It's going to include how we can understand drugs and how they work. But before we get into the video, remember to like and subscribe to this channel, and if you've not clicked on the notification bell, please remember to do so. This is how you can stay informed about more videos like this. And also, if you know any student that is struggling with pharmacology and just needs a ground understanding, you can send this video to them. Let's go. Alright, so first of all, we need to understand what pharmacology is in a nutshell, and we can do that using the medical prefix. So, pharmaco basically means drugs, and logos or logi means study. So, basically, pharmacology is about studying drugs. Now, according to our slide, pharmacology is the scientific study of drugs and their interaction with living organisms. So we are not just studying drugs as a thing, but we are also studying how it affects living organisms, right? It explains how drugs work in the body, which is like the mechanism or the mode of action of that drug, how it works. It studies drug actions, what they do, their uses, how they can help, and their effects. That is, what are the things that are a result of those drugs. When you take those drugs, what are the results? It also helps healthcare professionals use medicines safely and effectively. So pharmacology is trying to tell us we need to know about these drugs we are creating, how they can be used to help mankind, and then how we can also be careful not to allow them to cause harm to our patients or to living organisms around us. So now the main areas or the main branches of pharmacology. So pharmacology is divided into two main branches, which are the pharmacokinetics and the pharmacodynamics. So these two areas, they explain what the body does to the drug and what the drug does to the body. This is one of my very favorite quotes, or like say favorite phrases in pharmacology, because it's just it summarizes what pharmacokinetics and dynamics are all about. But however, we will still discuss this in further slides. However, like I said, these are the main. There are other branches of pharmacology, but minor ones like toxicology and all that, clinical pharmacology and all that. But the main two branches are pharmacokinetics and pharmacodynamics. What the body does to drug and what the drug does to the body. But yes, you may actually be asking, who needs pharmacology? Which professionals need this pharmacology? So first of all, pharmacology is studied by nurses, by medical doctors, by pharmacists, medical laboratory scientists, and other healthcare professionals. So basically, all healthcare workers must understand drugs to ensure patient safety. So the truth is that pharmacology spans throughout the medical field, even the radiologists, because they make use of a lot of contrast materials, barium, and all that. So, and they are also classified as drugs, right? So it spans out across the medical field in all branches, and it's very important, most especially in my understanding, for doctors and pharmacists and nurses, because the doctors are the ones that prescribe, the pharmacists are the ones that dispense, and the nurse is the one that eventually gives to the patient. If there is any knowledge in pharmacology lacking amongst these primary branches, or primary professionals that are coming in direct contact with patients and patient care, then there will be a lot of medication errors that could lead to detrimental results. This one is very very important. So many students have concluded in their mind that pharmacology is a very hard course, and that may now lead them to wonder, why am I studying this course? It's very important to know how important pharmacology is in the medical field. So pharmacology is important because it helps in safe medication administration. So just like both for the doctors mostly and for the nurses, they need the information about the drug in order for them to be able to know, the dose to be given, the route to be given, that is, from which side of the body should the drug enter the body, then side effects and the adverse effects of that drug, what are the contraindications of that drug, to avoid a drug trying to treat something and then eventually causing problem in another part of the body. So the next is that it reduces drug errors. Now this is very true, very much for the pharmacist, because when the doctor prescribes a particular drug, maybe it has a similar name or a similar maybe a brand name or trade name or whatever with another drug, and you are not well conversant with these drugs, you might as well go and dispense a drug that the doctor did not prescribe. And if the nurse also doesn't have sufficient knowledge about this, she might even go ahead and administer that drug to the patient, which will pose a lot of risk. So yes, it's very important because it helps to reduce any drug errors. It also explains drug benefits and side effects. Now, this is very important, especially for the doctors when prescribing, when they want to know which, because many drugs could be doing the same thing, but then their side effects could differ, and their advantages and benefits for that patient may also differ, right? In case of comorbidity, maybe when a patient has two different diseases and you don't want a situation whereby you're treating one and that drug you're using to treat one is actually making the other one worse. So you see that in that kind of situation, the doctor, with the knowledge of the benefits and the side effects of that drug, he will now be able to choose between those two to know which would be the best for that particular patient, that will not cause too many side effects, or at least will cause a side effect that the patient can manage. So the next is that it guides correct dosage and timing. So as a doctor, even as a pharmacist, as a nurse, and radiologist, you need to be able to know the dosages of drugs. And I know that this could be, it could prove quite hard. Yes, it's actually very hard, but the truth is, with practice, it becomes much easier. So it's very important, because wherever, on whichever chain you are, whether you're on the doctor chain or the nurse chain, you need to know, because imagine that a doctor prescribes a clinically unacceptable dosage of a drug. Now, as a nurse, all you have to do is carry out the doctor's orders, right? But then you still have the opportunity to make sure that this dosage is actually right, this route is actually right. But let's use dosage for this particular analogy. So as a nurse, you may not be able to challenge the doctor, but as well you can help or assist the doctor if you have the necessary knowledge. But if you don't have the necessary knowledge, it's just going to be like a blind man leading a blind man. You're going to eventually administer a clinically dangerous dose of a drug to a patient and get that patient in a lot of problems. So it's very important for you to know whether you are the one prescribing or you are not. It's important. So far as you are coming in contact with drugs, it's important. So lastly, it improves patient outcome. Everything a health professional does in the right way at the right time always improves patient outcome. So even in pharmacology, if you have the necessary knowledge about pharmacology, the overall effect is that it improves patient outcome and even satisfaction with care. So in a very simple way, a drug is any substance that when introduced into the body produces a biological effect, and most times it's a desired effect that we actually want to come about. And It's important to know that drugs can prevent diseases, that's vaccines. Drugs can diagnose diseases like, all these barium sulfate and the rest. Drugs can treat or cure diseases like our normal PCM, DEXA, and all that. And drugs can relieve symptoms. Also, these drugs. So these are like the general functions of drugs. Very important things, these things, very important. All right, here in these drug actions, we explored a little about it in the previous slide, so I won't talk too much about it. So drugs can produce different actions in the body, which are number one, the therapeutic effect, which is the desired effect, and that's will I say majority of the effects we all want. And the next one is the side effect, which is the unintended effect. It's not what we wanted to do, but we actually knew that something like this might happen. Then the adverse effects, which are the harmful effects. Yes, like all these drugs that they use for treating cancer in oncology. Yeah, they have a lot of adverse effect. But now for that particular one, I don't even know if we should call it a side effect and adverse effect, because the truth is that we actually knew that this was going to happen. So, but according to my research, they said, something like alopecia, which is hair loss from using anti-cancer drugs, can actually be classified as both an adverse drug reaction, and also a side effect. Please, if you know which it is, please can you comment down in the comment section and then give us your supporting points. So we're moving on to the next effect, which is the toxic effect. So this is a severe harmful effect. So understanding these effects is crucial in patient care, so that you know when something has gone out of the ordinary. Okay, normally when someone takes this drug, they used to have a little bit of rashes, maybe not urticaria, but just a little bit of rashes here and there and all that. But then when the thing is now raised bumps on the skin, and it's associated with maybe palpitations, associated with maybe diaphoresis and all that, then my sister, I know that is out of the ordinary. So you need to be able to differentiate what a side effect of a drug is, what its adverse effect could be, what its toxic effect means. And toxic effect is when the drug is in on like it's in clinically dangerous dosage in the body, or clinically dangerous level in the body. It causes toxic effect. That's the toxicity of the drug. When it's too much in the body, it now produces an undesired effect. So we should be able to differentiate them. All right, now for the routes of drug administration. So this is just simply telling us how the drug can enter into the body. So generally they can be enteral or parenteral, and I didn't write it here, but just know it. So enteral is just talking about something that has to pass through the intestine, where parenteral is the one that has to go around the intestine, which means it doesn't pass through the intestine. So we have the orally, which is of course enteral. We have the intravenous IV, we have that's through the vein. We have intramuscular, that's through the muscle. We have subcutaneous, that's under the skin. Topical, on the skin. Inhalation, through the nose. We have intrathecal, to the joint, and others. Now, each of these different routes of administrations have their that is, they have their benefits, their advantages, and their disadvantages, and not every drug can be given through every route. So it's very important, because if any drug is given through the wrong route, it can cause a severe problem. So it's very important for us to know the drugs and how, that is, the routes that they are compatible with, like something like let's say artemether. Now artemether, and that is a anti-malarial drug. It is an oil-based drug. Now what that means, that oil-based drugs don't do well in the veins, because they won't be able to what's the word now, they won't be able to dissolve. And not only that, it causes pain, so to the vein. So it's most times it's given intramuscular. You get, just know that every drug has its own special routes. So for drug names now in pharmacology, so drug names, it's very important for us to know because many drugs have very similar names, although the drug boards are working on preventing that, but you know that normally it's still going to happen in one way or the other. That's why we need to be able to know drug names. But then most drugs have about three different names, which are their chemical name, which is describing their chemical structure. I think the pharmacists will be more, and the chemical engineers will be more acquainted with that one. Diethyl butane, blah 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 blah. Those things we did in chemistry. Then we have the generic name, which is the official name, the non-proprietary name. That's the name is not owned by anybody. It's not a trade name. So it's a name that all these drug foundation, World Drug Foundation, US drug associations, they come together with other heads of other maybe continents or countries. Sorry, I said continents, other countries, and then they give that drug a particular name, right? So it's not owned by anybody. Then the brand name now is now the name that is given by the manufacturer, which is also known as the trade name. So let me give an example. Okay, there's an example here. So generic name PCM, paracetamol, and then the brand name Panadol. So that Panadol is the one that is the trademark. Any company that comes and use that name will have to answer to their lawsuits or whatever. However, it's legally handled. But then if someone is still calling it paracetamol, it's not your business because paracetamol, it doesn't belong to anybody. So that's how you know. So most times all these drugs they have this name, but the ones that will be more confusing is the trade name and the trade name and then the generic name. So we just need to be able to understand that and then be able to differentiate them. Without further ado, we are going to get into pharmacodynamics. So pharmacodynamics deals with what the drug does to the body. It explains how drugs produce their effects, the drug receptor interactions, drug potency and efficacy, desired and undesired effects. So like the name implies, the explanation is talking about what now the drug does to the body. What does that mean? What when the body receives the drug, what happens to the body? And even here we can now zoom in to now see how the drug achieves what it wants to achieve. We can now zoom in to now understand with how potent is the drug, that is how is this drug able to achieve the desired effect that we want, and in what dose does it achieve that, then why is it doing this? We don't want this. Why is it doing this? Why does this drug, when given, produce this particular effect in the body? So you see, it's talking about what the drug does to the body. So a little diagram to describe that. So we're going now into pharmacokinetics. I don't know about you guys, but I struggled a lot with what the drug does to the body, what the body does to the drug, pharmacodynamics. Anyway, so this is how I eventually got rid of that confusion. So pharmacokinetic, now like, okay, what is kinetic energy? Kinetic energy is energy possessed by a body in motion, right? So that means it's moving. So I was like, okay, so when the tablet is moving into the mouth, like I now imagined throwing a tablet into my mouth, and when it enters the tablet, when it enters my mouth, and how I ingest it, and how it enters my stomach, and then I break it down. So that was how. Now, okay. So that's what the body does to the drug. So that's okay. So pharmacokinetics now. Kinetic means as it's moving through the body. So what the body does to the drug. Then obviously pharmacodynamic now means the opposite, which is what the drug does to the body. So in pharmacokinetics, it deals with what the body does to the drug. It involves four major processes, which are the absorption, the distribution, the metabolism, and the excretion. So basically, when the drug enters, when you ingest the drug, it is absorbed by your body. When it's absorbed, it then distributes it to every part of the body. When it's done, maybe probably doing its work for that time that it's needed, the liver then metabolizes it, breaks it down, and then excretes it. So this is another little diagram to help you understand that. You can pause and then go through it. So how does pharmacology help to enhance patient safety. So I think throughout this video we have been dropping a lot of clues on this, but let's still go through it. Okay, so good pharmacological knowledge helps to, one, prevent medication errors, we've talked about it, identify adverse drug reactions early, we've talked about that one, administer correct doses, we've talked about that, educate patients properly. Yes, there are some drugs that when you give patients, you need to tell them whether not to eat, or how many hours after to eat or before to eat. Like when you're talking about maybe something like gestid, if a patient, it's having maybe some peptic ulcer problems, or something like that, you usually advise them to take the drug maybe 2 hours before they eat or 2 hours after they eat, to allow the drug to work properly. And definitely, patient safety is a core goal of pharmacology, because we don't want to be helping them, claiming we're helping them in one end, and then we're actually causing more problems for them, or maybe causing any iatrogenic effect. So it's very important we know this. So now for the summary about pharmacology, we say it helps us to understand what drugs are, how the drugs work, how the body handles drugs, why drugs can help or harm patients, and then a strong foundation makes advanced topics easier. Very, very true. You need to have a very strong foundation in pharmacology and every other course you are studying or whatever, so that when it builds up, it's like a building. So once you do the foundation, every other thing on top will be solid and it will last. But now, as your big sister, I want to give you some tips on how you can study pharmacology effectively and not just cramming or memorizing. So the first is studying drugs in classes and not individual drugs, because the truth is that even drugs, they have their own prefix, or most times it's a suffix that they use to identify similar ones. So instead of saying, studying the drugs one by one, it's better you study it in a class. When you study it in a class, maybe antihypertensive, then you look at their variations, then you should understand the mechanism of action. I cannot overemphasize this, because when you understand the MOA, which is the mode of action or mechanism of action, you can predict the side effects, you can predict the indications, you can predict the contraindications, you can predict so many things just from understanding the mode of action. Then link drugs to diseases they treat. Yes, do not, and I repeat, do not isolate drugs from what they treat. In fact, the way I do it is, first of all, I study the anatomy of that particular organ or whatever it is, the structure. I go into the physiology, know, okay, this is how it normally operates. Then I go into the pathophysiology, which is the disease, which is what could have actually gone wrong with this normal physiology, and then from there I now study which drug can be used to treat that effect. And because I know what is normal for that system and what is abnormal in that system, when I now study the mode of action of the MOA, then I'll know how the drug now works to restore that pathophysiologic state back into its regular physiologic state, making everything make so much sense. Then use tables, charts, and comparisons. Very, very, very important. Then practice drug calculations regularly. Also very important. So in our next video, we are going to be talking about pharmacokinetics in detail, pharmacodynamics also in detail, drug classifications, and then maybe some common drugs used in clinical practice. So stay tuned. Wow, thank you so much guys for sticking through till the end of this video. I'll be looking forward to seeing more of you guys. Remember to study. MedMinds loves you. Mwah.